Good afternoon or good morning, everybody. This is Sarah Hess from WHO in Geneva. I just want to say thank you so much for taking the time to join us on this webinar. It's very quiet here in Geneva. The majority of my colleagues at WHO are now teleworking, as I'm sure many of you are too. It's a strange new way of working, which we're all trying to get used to. And as we watch this pandemic grow, I think we're close to 400,000 cases globally now, and more than 16,000 deaths, unfortunately. We see about 196 countries affected. So really, we are all in this together, and it is a very strange and difficult time. So I think the purpose of this webinar, thank you for joining, is to really convene representatives from different faith groups and faith entities, and to try and take the opportunity to really consolidate the role of faith communities around the world during this pandemic. And the way that they can deliver accurate information to their constituents and provide support, provide care, and be a trusted source of information. And we would be delighted as WHO to support you in the work that you do. I'd just like to say, I'm going to hand over to my colleague Mindy shortly, but I'd just like to say that we have launched our new EPI-WIN website. So for those of you who have joined our community for the first time, EPI-WIN stands for the WHO Information Network for Epidemics. And the purpose of this network was to really try and reach out to different audiences who have information needs that are slightly different from others. So to try and then take WHO guidance that's being developed and translate it into a way that is more relevant and digestible to the different audiences. So we started these conversations with a group here in Geneva who have supported us in some of the dissemination and the outreach. So Francesca Morico and Monsignor Robert Vitilleux and Manoj from the World Council of Churches and Stefano from Caritas. And we hope to grow this network very widely and be as inclusive as possible. And so we do rely on you to distribute and to share this network with others, and to ensure that everybody has access to this and can contribute. And so in line with this, we have a new website which actually has a section in it for faith-based organizations and faith leaders. So I do invite you to go to this website. We can share the link in the chat, but it's essentially part of the WHO website. So it's www.who.int/EPI-WIN. And on this website, under the sector of faith-based organizations and faith leaders, we hope to be able to also link to some of the work that you're doing, to be able to share more widely good practices and the way that the faith community is responding in the pandemic. So without further ado, I think I'd like to hand over to Mindy. You would have received the link in the invitation to a guidance document that we're in the process of developing and would really like your input on. And I think Mindy will talk us through this. I'm going to stop my video, and I think we have a few slides to share as well. So Mindy, over to you. Mindy, you're on mute, sorry.
Hi, how are you? Good morning or good afternoon. Thank you for joining us today. I don't know if you can see me, but thank you for taking the time to be with us. As Sarah mentioned, it's really increasingly important for us at WHO that we are designing information that's more relevant and applicable to your settings. So this is one of the areas that we really felt was critically important in terms of the COVID-19 response, as there have been a number of outbreaks among faith communities. So we've had the honor in past conversations to talk to you about some concerns and some of the things you're already adapting in your faith settings. But we thought we would take the time today to really get down to actual recommendations that might work for the whole. So as Sarah mentioned, we shared a document that was pulled together from a number of different comments and perspectives and other documentation from past outbreaks that could hopefully gather some of the ideas and make it more applicable for your faith settings in terms of having safe gatherings, potentially considering some ideas for remote gatherings for worship, specifics on ceremonies to ensure that faith ceremonies can continue under the situations that are affecting many communities, and strengthening mental health and resilience among both faith leaders and practitioners. And then maybe the role that faith leaders can have in COVID-19 education. Whenever we think about sharing information and behavioral modifications that need to be made to prevent disease, we always look towards trusted individuals to share that information. In most every country in the world, healthcare workers are considered one of the most trusted resources, but there is no doubt that faith leaders are probably even more trusted with your practitioners. So we really, really need your help in this effort. So without further ado, maybe we could, unless there are any immediate questions or concerns, maybe we could just move forward in the slide. And what I would propose, slides, and what I would propose for the conversation is that we maybe chunk off different portions of the draft document that we sent and spend specific amount of times on each of the sections. So there seems to be about 5 sections that we focused on, but we're happy for other comments. So maybe if we take, I don't know, about maybe slightly less than 10 minutes per section, that'll leave some open time at the end for comment. And we continue to invite your comments on the document, but we'd like to pull it together into something that we could post on our website, as Sarah mentioned, within the next few days, as this is becoming more and more of a need globally. And I know, and Sarah also mentioned this too, that a number of your communities have already developed some documentation that we can also link to on our website. So that'll be very helpful, a strong partnership. So why don't we begin here in the document that we shared through Google Docs, and we're happy to see if others weren't able to receive it, if there's a way that we can share it in another way. But I see a number of comments in the document. Are there any overarching comments? So generally what we tried to do was pull together ideas just to ensure that if individuals are going to get together in a faith setting, that they maintain some measures that would help people stay safe. So maintaining at least 1 meter or 3 feet distance between practitioners, preventing any touching, handshaking and so on, and preventing any touching of devotional objects or other objects that the community is accustomed to touching or handling. And then just generally encouraging healthy hygiene among participants in faith services and other activities. And then frequently cleaning worship spaces and sites too. Things like doorknobs, handrails, and things like that, just to make sure that, that there's no spread of the virus on surfaces within the faith setting. So if we can start here for a couple minutes, I'm wondering if
Mindy, I can just handle this remotely. So if people have comments, they can just raise their hand. I can unmute you. You can make a comment. And if we don't have time to gather all the comments, as Mindy said, we can definitely capture those in the Google Doc or over email going forward. So yeah. I believe we have Robert, please carry on.
Yes, can you hear me?
Very well.
Okay. I guess mine was more an overarching comment, and it was one that I noted in the Google Doc already. I think that we need to be careful that we use the language that many religious organizations and religious leaders use. And personally, I do not hear, as I go around the world, references to faith actors. I hear more about religious leaders and faith-based organizations. And I know that if this document, which I think could be very valuable, and I know from my communications with Catholic Church-related people all over the world that we're waiting for this document, but if we're going to use kind of UN terminology like faith actors, I know that I will have trouble being able to even to disseminate it, let alone to get people to use it well.
Thank you.
Great, duly noted.
Joshua, please go ahead.
Hi, I'm Rabbi Joshua Lesser. I serve a congregation here in Atlanta, but I also started a Facebook page about responses to COVID-19, which there are now about 5,600 spiritual leaders from around the world. It's a very robust community. And a lot of the conversation that we're having here in the United States is about being 6 feet apart rather than 3 feet. And I would say an overarching question about how we can be responsible in putting out the safest guidelines is a lot of what the community has been discussing. And so I'm just wondering if there's a little bit of explanation about the difference between the 3 and the 6. If I were to share this document, it would be one of the things that people, I believe, would immediately jump to. And I don't want to, I want to be able to explain what the differences might be and why.
Mindy, do you want to answer that?
Yeah. Yeah, Joshua, I can, I hear you, and that's something that we recognized early on in this, and it happens quite a bit actually when it comes to US CDC recommendations. I understand you're probably right down the street from US CDC, and when it comes to WHO recommendations. Internally, we're also just looking at that recommendation. Right now, it maintains 1 meter globally because there's been studies that have shown that the virus droplet transmission is not more than 1 meter. And the reason it became that way globally is that it was recognized that in many settings globally, it would be really difficult to suggest 2 meters. I mean, certainly in parts of Asia, and things like that, where there's just a higher population, it was recognized that we needed to keep with the 1 meter distance. But for this document, maybe we can go back to our infection prevention and control people just to kind of, verify that. But that's generally the reason why there's been a difference between US recommendations and WHO recommendations.
Thanks, Mindy. Eamon, would you like to talk?
Yes, please. Well, I'll have to agree with the 2 colleagues. There are differences here. Joshua is recommending 6 feet in terms of religious gathering, particularly in mosques. The idea of 1 meter is not even easy to propose. For Muslims in mosque, it's always shoulder to shoulder. But the positive thing is, and I hope people are following this, is in many Muslim countries, particularly in Egypt, in Saudi Arabia, and other Muslim countries, the religious authorities have actually closed down mosques. So currently, in many countries, we do not have congregations, either daily or Friday prayers, which is a step further from what we're saying here. So I do recommend that we take into consideration differences between the 2 religions in terms of what is possible and what is not possible. In this point, the physical difference inside prayer houses would be difficult to recommend for Muslims. I have seen some Muslims do that in Canada, as an individual initiative, but as a wholesale, that would be problematic. One thing about the document is I would recommend to see some sources. I made a comment in one of the paragraphs. It refers to the Friday prayer and how if some people pray it, it's not obligatory to others or something like that. This is very sensitive material coming out of WHO in consultation with others. So I would highly recommend double checking, fact checking information, because I do not think that statement is factual. I have consulted with some scholars that I know in that short notice, and they say it's not factual. So I don't know how that goes. So over to you.
Thank you, Eamon. And I think I can speak for Mindy as well. We would really rely on you to assist us with that fact checking to make sure that the specifics for the different faith groups are as accurate as possible. And we can definitely find the sources, but might reach out to you as well to help us in identifying the most accurate sources. I think just to, sorry, carry on.
One? Yeah, sorry, Sarah. One further comment, because we had that on email. I think as IAG, which includes at least two prestigious Muslim scholarly organizations, Al-Azhar and Islamic International Fiqh Academy in Saudi Arabia, I think we would be willing to have a review of the final document. At least when it comes to references to Islam, and make our contribution if this is mainstream position or this is factual or unfactual, but not in the phrasing drafting phase. Maybe if you're willing, when a final draft is ready, that you can share before releasing. I think IAG would be interested to review that from a religious scholarly perspective and give its feedback in the parts related to Islam, of course.
Thank you very much. We'll take note of that. And just, I think with regards to the safe gatherings, we're very aware that a lot of religious gatherings have been cancelled or all over the world, at least the physical meeting of people. But I think we'd like to include something in here on it, at least, because different countries are at different stages of the pandemic, and you might see in places like China, where their epidemic is decreasing, that they're beginning to reopen religious gatherings, and while still trying to mitigate the risks of potential reemergence of COVID. And so I think we will try to capture some of that in the document as well.
Yes, absolutely, Sarah. One last comment. I know I have taken too much time. One last comment is IAG is in the process of releasing a joint statement. It sort of lays down the Islamic perspective on COVID-19 and with a set of recommendations, specific recommendation regarding prayer, hand washing, physical distance, and so on. So we will be glad to share when that is out, so you can all we can all benefit from whatever products is coming out. Thank you.
Thank you. I'd like to hand over to Olivia now.
Hi, Olivia Wilkinson from the Joint Learning Initiative on Faith and Local Communities. The points that I'd like to make is just following on from your previous point, Sarah, is how you will add maybe something along the lines of how to make the decision of when you gather or when you close your services or open your services, because it surprised me that there wasn't that much in the document about when to make that decision. I think there was notice, about the national authorities might be making that decision, but for individual groups, I think there might be, maybe I've missed something, but there might be space for that. Another thing that I'd like to just add to the conversation is that I think that we could use an even more generic term than faith-based organizations. Faith-based organizations is even quite jargony and might, in some people's minds, only refer to, you know, the NGOs and things like this. So I think something along the lines of faith communities or faith groups is even wider and permits a larger number of people to identify with this. And we also need to just be careful about the term religious leaders, because it's not only the religious leaders that will be making many of these decisions. And obviously a lot of the language says religious leaders and faith actors and FBOs at the moment. But, you know, especially practice, you know, setting up services, etc. It's not only going to be the religious leaders making these decisions, and there needs to be language that perhaps identifies when it's particularly to religious leaders and when it's to other people that are taking informal leadership roles within the groups, and you know, groups that don't have leadership in the same way. So I think being slightly generic in the terminology or allowing a big space in the terminology is advantageous in this case, rather than FBOs or, you know, something more specific. Faith actors, obviously too jargony as well for this as well. And just to say, we're Joint Learning Initiative is working with UNICEF and RFP, Religions for Peace. Might be a few people on the call as well. Also to work on messages, but greater guidance for faith groups in this area too. So we'll hopefully be in touch in the next few days around this as well. I believe there's probably various people working on this at the similar things at the moment, but some areas that we're hoping to touch on that I don't think are touched on here and don't need to be touched on here, but things like you know, stigma of people who have recovered from COVID entering back into communities, how religious leaders can help with some of those elements, help with the process after the tailing off of the pandemic as well, etc. So there's areas that are not immediately addressed in this document and perhaps don't need to be in the initial phase of this, but could be included later on.
Thank you very much, Olivia. We'll capture those comments. I also, just to go back to your first comment about the decision about when to cancel or when to restart, I have a colleague, Amaya, who is on the line, who works with our group on mass gatherings, and I believe that they are developing some guidance around this. Amaya, do you want to say a few words on that?
Hi, Sarah. Thank you very much for the opportunity. Yes, indeed, we are working at the moment, which has published and is online a risk assessment for mass gathering events in this COVID-19. And at the same time, we're working and trying to do some specific guidance for faith-based organizations, faith communities on this, for when getting ready again for this big event. So couple of you, the colleagues that are on the line, they've been contributing in, and we're keeping an eye as well on these recommendations that you are giving in this webinar, in this new guidance, to make sure that that is aligned as well. So thank you very much, and if you have any specific questions as well, I will be happy also to answer. So thanks, and over to you, Sarah.
Thank you. Tom, over to you.
Sure. I'm Tom Davis, Partnership Leader for Health for World Vision, but my comments here are actually from my wife, Reverend Judy Davis, who's with the World Methodist Council. She also found that the faith actors phrase would be difficult language for many clergy to use and interpret, and so we need to land that group. She also mentioned that there's a sentence on that first page: sermons and messages should contain factual information approved by WHO. Seemed a bit off-putting for some reason. It might need rewording, as it sounds like WHO is kind of approving sermons. Maybe something like facts on COVID-19 included in sermons and messages should be based on information provided by WHO. And Darlene Rubenheimer on our team made other suggestions, but those are reflected in the Google Doc. Thank you.
Wonderful. Thank you, Tom. Very, very helpful. Catherine Marshall.
My comments very much echo what Olivia Wilkinson said, and because we're working together closely. The point I want to emphasize in whatever language is used, whether it's faith actors or religious communities or whatever, is that it's important to be inclusive. And I think that's a critical issue, both for as a message to religious communities, but also a parallel purpose of the document and of the efforts we're making is to ensure that the religious dimensions are part of the public health thinking and consideration and policy making, and the image as well as the reality of an inclusive approach is critical for that. It's important, therefore, to avoid simply talking about religious leaders, because that can be understood and interpreted as formal clerical leadership as opposed to groups or people that, such as women, youth, who hold informal positions.
Thank you very much, Catherine. Just for the benefit of the others on the line, do you mind introducing yourself?
Sorry, I'm Catherine Marshall. I'm at Georgetown University's Berkeley Center, and I lead the World Faiths Development Dialogue, and have been involved initially at the World Bank for many years, but for the last 14 years at Georgetown in trying to build bridges between religious and secular organizations and debates around international development and humanitarian relief. I also would add that we're very much focused at this point on the G20, which is meeting today in a virtual summit, and the ways in which religious communities might be contributing to that kind of global governance consideration.
Wonderful, thank you very much. Adriana, please, you have the floor.
Thank you, Adriana Gastelukamp, Church of Sweden. I was thinking that one of the things that we have already get some reports are the increase in violence in home when people are sitting in quarantine. So important to the religious leaders and faith leaders to encourage to peace and harmony in families and groups, especially violence against women and children. Many persons are frustrated because they can work, they don't get enough money for the family, and this is one of the factors that increase the level of violence. So I think it's very important that this also a part of the recommendations on well-being for the people, and it's an important role for the faith-based organizations. Thank you.
Thank you. We will definitely try to capture that. Christina.
Yes, this is Christina from Islamic Relief USA, and I've put a couple of comments in the chat box, so I won't take up too much time. One, I shared that some guidance came out yesterday from the Fit Council of North America around both prayer and the suspension of services, but also around the washing of bodies and funeral practices. So that's some guidance you may want to look at. And then separately, I was just mentioning that as a large federation with country offices in over 40 plus countries, we would be a great partner. So back to the first comments around building trust, I was inquiring whether the document, once it's finalized, would be able to be co-branded, and then also an inquiry into how many languages you are intending to publish it in. Thank you.
Thank you, Christina. I think this is a discussion that we do need to have with anybody who contributes to the document, whether or not they would officially like to be acknowledged as a contributor. But I think for all of WHO's documents that we're producing, we're trying to at least translate them into the 6 UN languages, but would facilitate further translation. I think where possible and where we do see a need. I think, Stefano, would you like to speak?
Yep. Thank you very much. Thank you very much, Sarah, and good afternoon, colleagues. Yeah, first, I want to thank you for the information on the website of the.
Sorry, Stefano, can you just introduce yourself? For
Oh,
those
yeah, so sorry. All right, sorry, very right. Sorry. Stefano Nobile, I am a focal point for health and HIV of Caritas Internationalis. As I said, I want to really thank you for the information on the EPI-WIN website. I will include it in the Caritas Internationalis virtual platform on COVID-19, because I think that there are a lot of useful information there for all our members. And vice versa, I will discuss with the Caritas Internationalis leadership to see if we can feed into your website with documentations on activities or other information carried on by our members. So I have a couple of comments. First, I think that the draft that you shared, frankly, is very well done. Thank you very much for this effort. It was not so easy, I think, to collect all inputs done during the last virtual and in-person meetings. So thank you very much for that. I would suggest eventually, as I said during our meeting, if we can eventually add a part on actionable practices. There is a religious order in the Catholic Church history, which has as a motto, act and pray. And I think that it's important to bear in mind that religious leaders and faith-based organizations, they also act, not only pray. There are a lot of good practices done by Caritas, because I work for Caritas, so I know them, for sure done by others, that could give useful information for those that would like to support their own communities. I said rightly enough religious leaders and faith-based organizations, because to me there is a difference between an individual who serves a specific church, in our church as a priest, and there is a difference between this category and faith-based organizations, where there is a structure inspired by a specific faith related to a specific church, but that structure is more the humanitarian branch of a church. This is my overall comment. Thank you very much.
Thank you, Stefano. And the invitation does go out to other communities. If there are documents that you have published that you feel would benefit others and would like to be more widely shared, do share them with us, and we can link to them from the website. Jürgen Thompson. Maybe I said your name incorrectly.
No, it's fine. Thank you. Jürgen Thompson from Dan Church Aid and the ACT Alliance. While I understand the logic that this guidance should be relevant to many contexts, we are in the ACT Alliance very concerned that it should not encourage gatherings that cannot be managed safely, even where they are still permitted. And that's why I would recommend that the comment made by Monsignor Vitello in the text, which says, if you are not able to perform these steps to keep your community safe, cancel then the planned physical gatherings. That this comment should be highlighted and maybe preface this whole discussion, so that ideally, I would actually like to see a strong recommendation not to gather physically, especially when you are in the startup or peak of the virus spread. I can understand in China, where you are exiting the virus spread, there may be different possibilities. But if we could strongly underline that if you are not able to perform and guarantee these precautions, then you should call it off. That would be my recommendation. Thank you.
Thank you very much for your recommendation. Sally.
there. My name's Sally Smith, and I worked for UNAIDS as their senior advisor on faith for many years, now working as an independent consultant and teaching at Leeds University. I responded to Monsignor Vitillo's comment on the terminology in the chat box, but I think many people have commented on it since. And WHO, along with the 10 UNAIDS co-sponsors, along with a whole group of faith-based organisations, did come together to look at the terminology on faith-based organisations, and that's included in the UNAIDS strategic framework for partnership with faith-based organisations, and it does capture many of those different nuances that other people have brought up on the call today. So I think that's already been agreed. It's already been agreed by many who work in this field and have done for many years, and it might be a good starting point for this discussion with WHO. The second thing I wanted to raise was also in conversation with the Anglican Alliance and a number of partners working on this epidemic already. One of the roles of faith-based groups over many years has been to look at in the erosion of civil liberties around a public health emergency or in situations of conflict. Where are people's rights being transgressed, and what's the balance between necessary constriction of civil liberties and then abuse that leads to stigma and discrimination and potentially violence and community violence. And so I think that's an important issue, that the faith-based groups can be a very, very critical watchdog at a national level on some of those critical areas that it will be important for this group to discuss. I'm not sure if it's right for WHO to flag it in their guidance, but it may be a useful relationship for WHO to have with faith-based groups moving forward. Thank you.
Thank you, Sally, and we'd welcome any advice or input you might have as to how we can create a forum for that kind of a discussion as well. Suleiman Malik, over to you.
Thank you very much. I'm Suleiman. I'm part of UNICEF immunization teams in headquarters. Just 3 very quick points. One is that I think there was some very interesting suggestions and thoughts on the overall focus of this guideline. And my feeling is that probably religious communities, if we keep the focus on religious communities, that includes all range of male, female institutions, individuals, probably that would be more helpful. My second point is, I'm sorry, today is my only first engagement with the whole process. And therefore I couldn't go through the draft, but my second feeling is that a global document coming to a country and then asking religious leaders to do certain things and take lead on certain behavior change efforts will not work unless it is combined with the relevant theology. So when I say relevant theology, it means this guidance needs further versions within their respective religions or faith. For example, if it is Christianity, if it is Islam, the relevant dogma or theology, if none attached to that, then the only guidance will remain guidance. The actual inspiration to religious leader comes from their own theology. So unless that combination is not there, and combination is what that respective theology says about that particular behavior, process, and situation, then it will be very helpful to give them a guidance and suggestions and direction on how to do it. So unless that combination is not there, it will be helpful, but it will not be very helpful. And finally, my feeling is that in this time and situation, unless we don't do joint documents, it will remain again a very limited effort. So I would suggest that all those partners, that even the partners who are not in this process today, they need to be part of this process. So there is more ownership and more usage of this. Over.
Thank you very much for your valid comments. I would ask Mindy also to jump in here, but I think as WHO, we're aware that we develop global guidance, and this needs some adaptation and translation to make it really relevant, as you're saying, to the different communities. And I guess that is the role of the different faith communities to take the science, but then to make it relevant and adapt it, to combine it with the theology. And this is something that WHO would be very happy to review the guidance that you've developed to make sure that the science behind it is correct, but then obviously the different faith communities combining the theology is definitely their role. So Mindy, is there anything you want to say on that?
No, I just, I mean, I echo your comments. I think this is something that we struggle with. It's a very difficult thing to do at the global level of WHO, to make sure that we're adapting our recommendations in different settings and so on. So maybe as part of your comments to this, just inviting ways that can help us in this guidance better be able to specify recommendations for different practices in different regions. I mean, maybe we leave open boxes as examples and things like that that can be used for different faiths or different practices, and maybe even be more regionalized as needed. So I think we're looking at very, like to look at very creative ways to make sure that this is relevant in different settings. So we hear you, and we need your ideas on how to better do that. And I have to emphasize quickly. I know we're talking about a lot of global agreement messages and making sure that everybody's involved, and that's why we're here and we're talking today. It's among the first of many efforts that we hope to continue to reach out. But we do need some guidance out quickly, as you can see the speed at which COVID is affecting our world. So yeah, thank you.
Thanks, Mindy. John Blevins.
Hi, good morning, everyone. I'm John Blevins. I'm on the faculty at the School of Public Health at Emory University in Atlanta. We have a resource page on our website with currently about 60 resources, more going up regularly, for religious leaders and faith communities, a variety of resources. I'll share that with the WHO colleagues to disseminate. My question was, I think these recommendations around what we know from evidence related to limiting or slowing the spread are good, and they do need to be contextualized, and I think that's an important issue. I would also wonder if we might think about ways that we support religious leaders who very much want to get these messages out in their efforts to challenge and counter bad messages and rumors, particularly, and resistance to these practices, particularly when those kinds of rumors, bad messages, and such resistance are coming from religious leaders themselves. I think that a religious leader or a person of faith talking to another person from their own tradition on these kinds of deliberations and to counter bad messages with more positive ones has much more power than if a public health authority does that. And I would wonder if we might give some strategies for religious leaders to do that, and even provide some kind of structure to support and brainstorm with them to do that effectively. I have real concerns that as the virus spreads throughout various global contexts, that this issue is going to become front and center in some ways we saw with Ebola.
Thank you so much, John. This really was a point that arose on earlier conversations, and that was the support for faith leaders or religious leaders. And perhaps this can be a parallel stream of work. Happy to connect with you on that and others later. Daniela.
Yes, hi, good afternoon. My name is Daniela Genrich. I'm from South Africa and part of the We Will Speak Out South Africa Coalition, which works on gender-based violence in the faith sector. I'm also part of a broader ecumenical response that is in the process of being developed to COVID-19. I don't know if people are aware, Africa has come in a little bit later in terms of the crisis. we are facing rapid increase in infections and so on. So have really been mobilizing on this side. So we greatly appreciate this kind of initiative, also so that faith leaders in countries that have not dealt with this as much as other countries, for a document like this from the WHO, so that we can get information out a whole lot quicker. So thank you. And there's just a couple of points. I want to just echo the issue, obviously, around domestic violence and child abuse and those issues. And if there were to be a team that is looking into guidelines for faith leaders, religious leaders around that issue, and being responsive to that issue in quite concrete ways, I would be willing to be part of that process. We are trying to think through guidelines in the South African context, which is one that has one of the highest statistics of gender-based violence in the world. The other issue is what I'm not seeing, although I didn't have time to study it in great detail in the document, is the whole question of social justice and a lot of the guidelines for social distancing and self-isolation and those things. And we are tomorrow night at midnight in South Africa, we are facing a national lockdown. And there is great concern around areas, informal settlements, township areas, hostel areas, and so on, where such things are not as easy as in others. And we've been grappling as the faith sector around, well, what does that mean for churches and other faith institutions in different areas where there is overcrowding already, where there are shanties and people are not necessarily safe in their own homes, either from their own family members, but also in the sense that their structures are not very strong, but also that in these contexts, we have workers in a lockdown situation who are going to find themselves not being able to earn, and already we have very high levels of poverty and unemployment that is now reaching around 30%, and in some areas is higher, 70, even 80%. So I'm just wondering, I know it's not necessarily a global issue, but I think similar things will be issues in a number of countries where social inequality is quite extreme, and it would be useful for us to consider some kind of guidelines in countries where there is extreme inequality, and the kinds of responsibilities of churches in more advantaged areas to support those in other areas. I think that what we are looking at in South Africa is the possibility of dire emergencies, and I suspect it may be similar in other contexts, and not just post the viral stage, but even in the midst of a lockdown. So it's a particular area that I don't know if other people that are present at this meeting or others in similar contexts would be able to contribute, maybe have gone further in being able to offer guidance, to help us also in trying to develop these guidelines now for faith leaders in a context of great inequalities. And in relation to that, I just also want to lastly affirm the questions around how do we develop theological responses, given that in some countries like South Africa, and I know other countries in Africa which have been very much under the influence of a kind of a church sector that has offered quite simplistic and sometimes destructive prosperity theologies that have not necessarily offered people the kinds of the kinds of theological belief systems that are actually able to strengthen their psychological and spiritual sustenance. And we have a massive outbreak, if I can call it that, of incredibly destructive theological so-called pseudo-theologies that are running rampant in social media circles, and that does seem to be something really important that support is given to being able to respond to some of these very destructive dynamics that are only increasing the agony among people in general. Thank you very much.
Thank you very much, Daniela. It's your comments around the inequality really do resonate, and I think we're going to be seeing this more across the globe. We've obviously heard that India is also going into lockdown, and you have a very, very dense population with huge inequality. We do have actually another EPI-WIN call tomorrow with, it's not the faith sector per se, but it's with employers and workers, and we have somebody from the representative from the informal sector talking about the impact on the informal sector during the COVID pandemic. So if you do send me an email afterwards, I can share that link with you for that webinar if you're interested. And if anybody does want to respond to Daniela in terms of guidance, the guidance, contributing to the guidance that she's delivering, again, I can try and put people in touch with each other. I'd like to hand over, and I'm aware that we're kind of running through our hour very quickly. We really value this time and your comments. So I'm going to try and give a few more people the opportunity to talk. And if we don't get everybody to speak on the phone now, then at least we can follow up over the course of the coming days. Anyway, Tony, over to you. Tony, you're on mute.
Can you hear me now?
Yes, I can hear you.
Okay. So my name is Tony Krugai-Bazibwe. I'm from the Global Interfaith Network for People of All Sexes, Sexual Orientations, Gender Identities and Expressions, and we're also based in South Africa. I wanted to support the things that various people have said about gender-based violence, particularly in view of the fact that sexual and gender minority people in this situation are often more vulnerable, are often less safe in their homes, less safe in their communities, and that, of course, these kinds of situations where many people are very stressed and concerned about their survival, do contribute to increasing that violence. I think that's particularly important, and Daniela, for example, has talked about bad theology. John has talked about bad theology. To note that there are already people, religious leaders out there, who are talking about the COVID virus as the result of the acceptance of LGBT people in various societies around the world. And I think that it's really critical. I realize that there are a range of perspectives of the people on this call, and that's fine, but I think that it's really critical that part of what we encourage, part of what this document encourages, is some kind of appropriate response to people who incite violence against vulnerable communities. I mean, it's one thing to say people are welcome in this community, but it's another thing entirely to incite violence. And I think that it's really important that somewhere in this document, and unfortunately I haven't seen the document, that somewhere in this document there's something about faith as a source of understanding of do no harm, and that and I think that that's more broader than sexual and gender minorities. It applies to a multiplicity of vulnerable populations. And it also, of course, applies to bad theology generally that encourages, for example, in this context, gatherings that in fact are unsafe.
Thank you very much, Tony. Matthew, a few quick comments, please. Thank you. Matthew, you're on mute still.
Can you hear me?
Yes, we hear you.
Yeah, I'm Father Matthew Abraham from the Catholic Health Association of India. We have a similar situation like South Africa. We are locked down, so there is no problem of gatherings, and most of our religious leaders have given instructions to be at home to people. But our problem is, how do we handle this kind of a situation where there's a huge burden on the health system? How do we protect our caregivers, especially from burnout? And how do we also, if there are some guidelines on how can we do some task shifting, how do we optimize our resources? Those kind of guidelines could be helpful. So my comments are mostly related to action in the field, because most of our, one of the areas where religious groups are involved is also very much action in the field. Thank you so much.
Thank you, Matthew. Really valuable. We also, again, hold another webinar each week with the health sector on which we do discuss some of these issues. We have people sharing their experiences from hospitals around the world, and we talk about how to really translate WHO's guidance into lower resource settings or settings where the health system is overburdened. So I will also share with you the links to those calls. Rachel, over to you.
Thank you so much. I'm conscious time short. I've actually just put my comment in the chat box. It was picking up on this issue of social inequalities, and just to say thank you for the guidelines. I'm Rachel Carnegie from the Anglican Alliance. Just so they very usefully address health issues in terms of us as worshipping communities, but also we're involved in serving wider society and the vulnerable there, and it'd be very helpful to have a few guidelines just on how that might be sustained and sustained safely. Second quick comment is just to sort of extend what John was saying earlier, that I think what we've learnt from the involvement of faith communities in the Ebola response is the importance of looking beyond the public health messages to cultural, spiritual, psychological reasons why those messages don't necessarily connect with communities, and how we can work with communities' fears, interpretations of the nature of disease and so on. So I think just to say, not that one can give details on that, but that in each context, encourage the faith groups to look at those issues and address them. Thank you.
Thank you very much, Rachel. I'm afraid we're probably going to have to stop now, just because we're running out of time. And I know time is one of our most precious resources at the moment. I'd like to hand over to Mindy for a couple of closing remarks and next steps.
Sarah, this is Maurizio speaking.
Hi Maurizio, I didn't know you were on.
And good morning, good afternoon, everybody. It's just a marketing interruption, just to tell all in line that tomorrow we have another webinar on the mass gathering that is a continuum between the separation that we are living in and a bit more peacetime or recovery moments. So if you are interested, you can just ask and flag it to Sarah. So we use each of these webinars to cross-pollinate and to inform the larger base and footprint of the society possible. Thank you. Ciao, Sarah, and everybody.
Thank you so much, Maurizio. Mindy.
Yeah, thank you, Maurizio, for advertising the next one. And as he just mentioned, it is interesting to me that we're learning things from this webinar that can apply for healthcare workers, we learn something from healthcare workers about burnout and so on that we can apply to this setting. And, you know, just the safe gatherings that we're learning from the mass gatherings as applied to this. So it's really a very rich discussion for all of us. And I'm sorry that we've run out of time and couldn't capture all of your questions and comments. We will save what's in the chat room and capture those comments and respond back if we need to. I'll say that we'll keep the document open in the Google Docs, and we can resend out that link if those of you that need it. If you want to have provide some other comments to this. We also would like your creative ideas on how we can make this more relevant to different settings and different faith practices and so on, so we can kind of capture specific needs and address the specific types of practices to make it more useful at regional and country levels. So not just sort of what's said in the document, but ways that we can present that information to make it more helpful for you. We will be translating it, of course, certainly in the 6 different UN languages, but we also have some ways to get it translated into other languages that might be more specific to your needs. But I would say, why don't we do this and keep the document open for maybe throughout Saturday or so, and then we'll capture your ideas either by, if you can email them to EPI-WIN, EPI-WIN.INT, and then we'll just keep the conversation alive. We'll have another one of these calls next week to kind of keep moving this idea forward. Yeah, I think that's about it for me. Sarah, did you want to add anything else before we end?
No, I don't think so. Just please do share also this network with other people, because we don't have a comprehensive list and we don't want to be exclusive. So whoever you think would benefit from or be interested in, please do bring them on board.
And just to add to, we may have some, as we think about how to do this, have some specific asks for each sort of faith area, specific things we need to ask about so that we can include it in this guidance. Either it's ceremonial practices, maybe a statement from a key leader that can help, help inform, as I think somebody had mentioned, other faith leaders that don't understand or not understanding the science and the threat of COVID. So some specific asks may be coming your direction, so we'll appreciate that in the future if you can help us with that. And really, well, we always value these partnerships, and as mentioned earlier, these ability to reach out to individuals through trusted sources of information. We appreciate it now more than ever. Your work and your help will definitely save a life. So thank you.
Thank you, everybody. We will try to have a meeting or a call once a week going forward, so I'll send through details of that.